Now more than ever, surgical services efficiency and performance is a hot topic at the C-suite level and the board level for health systems. And that's because there is this tight crunch and within anesthesiology services, within nursing services, and you have to make the best use of the resources you have in this type of market. And when surgery is driving most of your financial performance, it cannot be neglected. And so one of the pitfalls that I see administrators doing is saying they want to just fix this one thing or this one area, meaning just improve block or just fix my nurse staffing. And yes, that can be done and it can be effective, but you're missing the opportunity to look at it comprehensively. And, instead of something taking 3 to 5 years, the 3 to 5 year roadmap to get to surgical services, it potentially can be done in 9 to 12 months if you look at it in parallel and concurrently, where you're fixing central sterile processing, you're fixing PAT, you're fixing the main OR, you're looking at your non-operating room anesthetizing locations like endo, GI, and they're all happening together, because this is what fuels your OR governance. It's what fuels the performance improvement teams and the subcommittees when you're looking at them concurrently. Because what happens if you don't is, you peel back the onion a little bit and you say, well, the issue with the turnover times is actually what's happening in PAT. We're not prepping our patients correctly, or we're not looking at bioburden. We're not getting the bioburden off our instruments in central sterile processing. And there's no place to take that, other than the typical manager, but there's no committee that feeds up to that, or governance committee, or no initiative that can really take on anything beyond just the day-to-day operations, which is a ton of work in itself. And so it allows everyone to rise up for a period of time and to think strategically and to figure out how to collaborate across each of those areas and departments so that you can drive a ton more change in a short period of time. Now, the pushback is usually, we don't have enough resources to do this. Everyone's already so busy and we're so short-staffed. And so it is helpful to bring in help short-term, invest a little now so that people can walk arm in arm with your OR director, with your central sterile processing supervisors, with the chief for anesthesiology, and work together to do that work. So outsource a little bit of it in a short period of time so that then your leaders can sustain it and they can take that on, because now it is more efficient. Now there is structures, there's rules to live by, instead of each problem being a new problem, or without the accountability to hold people responsible for their behaviors. And so I do really encourage people to look at it more comprehensively if you really want to drive the change to resolution, to outcomes. Otherwise, you're going to be 5 years down the journey and say, oh, we're still not where we wanted to be or needed to be.